All right, it's Monday, and our doctor on call today is a new guest here at the Noon Show, Dr. Blaine Price from the Center for Men, and he's here to answer some questions about low testosterone. Welcome, Dr. Price.
Hi, thanks.
Well, three questions, and the first one I want to get to is kind of just straightforward and really basic. How does someone know if you have low testosterone? What are some of the warning signs?
Well, there's a lot of symptoms. I mean, the main one usually is fatigue. Your testosterone's higher in the morning and then gets lower throughout the day, and if you're low already, by the time you get off work, you can be pretty tired and become a couch potato, so to speak. You can also start to gain some weight around the middle, lose muscle mass. People will tend to have a depressed mood. In fact, depression is one of the symptoms too. And then you can have problems with sugar. So type 2 diabetes is a real common complication of having low testosterone.
Interesting. And I was going to say, when you were talking about, weight loss and maybe kind of slowing down, some of that is part of getting older. And so how do you kind of separate that with, testosterone, or is it all kind of one and the same?
Well, that's a good question. Some people have said that they think that low testosterone is just a normal component of aging, but some studies have said that they don't feel like testosterone should drop as much as you age as what has been previously thought of.
Yeah.
So right now we use the same levels for all ages of men, and we don't really use a different level like as you get older for different age groups.
Interesting.
When diagnosing.
And at this point, with low testosterone treatments, I guess that's one way you can go. Does insurance typically cover low testosterone treatments?
Oh yeah, the majority of our patients are on insurance and use insurance to pay for their treatments.
Okay, that's good. And then the final one is just quite simply recovery time. I mean, when do you start feeling better after a low testosterone treatment? When do you kind of rebound?
Well, again, that's variable too. It depends on how low you are. We start people at similar doses of testosterone when we replace it. And people respond differently, so it's not really based on weight or what your level starts with. So some guys will take more to get their levels up into the normal range, and other guys won't take as much. But we start at a certain rate, and we follow up with people and recheck levels. And so typically once their levels get up into the normal range, they'll be feeling quite a bit better. So for some that can be right off the bat, and others it may take a few treatments before they really see a big difference.
And then one last thing, about men. Obviously we know low testosterone directly affects men, but this can affect their partners too, and wives as well. It can be a tough thing.
That's right. If women out there have any of their partners or husbands that they're worried about that might have symptoms like this, we have a special for $20, so that might be a good Valentine's Day gift.
All right. Well, Dr. Price.
The man in your life?
Yeah, absolutely. All right. Well, Dr. Price, thank you so much for joining us.
Oh, I appreciate it. It was interesting.
Yeah. All right. Well, you did a great job. First time. Great job.
Thank you.
All right. Thanks, doctor.